Hey, welcome everyone. Today, Dr. Carr and Dr. Elizabeth Delanis, um, and we are presenting public health, the program and career. We just want to give you a little bit of a background on public health and introduce the new program that we developed for the college.
Okay. Thank you, Dr. Delanis. Many of you are interested in the public health program, and you're probably asking yourself, what is public health? How do public health fit into the health arena? And so we have created a PowerPoint that discusses some of the basic and some of the important information about public health. While public health is the science and art used to prevent disease and health issues in large populations.
Yes, and public health is really interesting because it works from a preventative framework. So, in public health, we promote and protect health and communities so that people can be healthy where they live, learn, work, and play. So, in public health, there's all different types of professions that fall under public health. But generally, what folks in public health do is work to ensure the conditions in which people can be healthy and thrive. We want to prevent illness and injury as well.
Excellently said. Again, the overall goal of public health is to improve the health of communities through prevention program. And if you can think of it this way, public health is more of a proactive care versus reactive care.
Great point. And we work at the level of, we said this on the previous slide, but just to reiterate, we work at the level of the population or the community rather than an individual. So public health focuses on groups. It's like sociology in that way. It's about the health and the conditions that affect groups of people.
Absolutely. Public health is used to determine social factors that cause health disparities, to improve current environment circumstances, directly linked to diseases and health problems, also to empower affected populations to advocate for change, and to promote healthcare using quality, equity, and accessibility. Another thing to add to these slides that was not mentioned is when you think of public health, not only can you do it on a community level, but you can do it as we see with the coronavirus, communities are affected. It can be states or cities. It can also be continents and even the world. So it works on preventing diseases and health problems on various scales.
Yeah, and we're going to give some examples in a few slides, but really, those were some general overall goals. And you'll notice that they're really focused at that macro level. But here's a few more examples of things that fall under public health. So these are like disciplines of public health at the top here. So we have epidemiology and biostatistics. Um, Folks in these fields usually investigate or sometimes investigate disease outbreaks or study health outcomes and carry out disease surveillance. So they do this through statistical and scientific methods. Um,
Absolutely. We also have behavioral health and research and interventions, health education and communication, health policy, and environmental and occupational health. One of the things that came to my mind when we were thinking about public health, if you guys live in the Philadelphia area, we are not sure who's going to see this PowerPoint, but if you live in the Philadelphia area, you will hear a lot of the news people and those on the news talk about gun violence as being a public health issue. And so we want you to expand your thoughts and realize that it's not only just health as it pertains to some of the things we relate to health, but just overall health, person, community, just to make sure and reassure that we're safe, not only on a physical aspect, but more so on from a security aspect as well as mental health.
Those are great examples, and a few more that you'll see here on the bottom of the slides. Vaccination programs fall under public health, smoking prevention, alcohol education programs in colleges, advocating for healthcare reform is a public health activity. School nutrition education and access programs, as well as setting workplace safety standards to protect employees. These all fall under the purview of public health.
Absolutely. Great point. So as you all know, that Community College of Philadelphia, better known as CCP, is starting a new public health AA degree. And that's where Dr. Delanius and myself come in. And the CCP program now offers a public health AA degree beginning in fall 2021. And we're excited, so that's why we want to give you some information on the program. The program will prepare you to transfer and obtain a 4-year degree in public health. Some of the classes will include Intro to Public Health, giving you an overview of what public health is, health policy. We failed to mention that earlier, but health policy is very prevalent and important in public health. That's why some of the policies are being made as it pertains to wearing your seatbelt or who is allowed to purchase guns and things of that sort is related to health policy and how these policies intertwine with keeping the public health safe, and of course health promotion and a lot of other things that we also discussed earlier in the PowerPoint presentation.
So to enter the program, you will need to be in good standing with the college, and just ask the advisors to add you as a public health major. And you'll be starting, if you decide to, you'll start in Public Health 101 in fall, which Dr. Carr and I are really excited about. You can also email us for more information or to talk more about public health. So our emails are listed there in that bullet point. And I just also, we wanted to mention a few jobs, and we could think of a lot more, I'm sure, if we talked, but just some examples of jobs that folks who go on to complete further degrees in public health can obtain. Things like an epidemiologist, a health educator, a health policy analyst, a health administrator, a restaurant inspector, a community health worker. These are all jobs that folks have education in public health to do.
Absolutely. And also to add on to that, one of the things that you'll notice lately is that they're encouraging a lot of nurses and doctors to have a public health background because they realize that the micro view of responding to health is not as effective as a macro, as the public health perspective or approach. And so it is being encouraged. So that's just a brief overview of what the public health program will have and what public health entails. And as Dr. Delania said, we can add a whole lot more to public health. If you have any additional questions, you can always email us, and just remember the goal is to improve the overall health of the entire population. And so it's a massive amount of work that can be done under the public health umbrella.
Yes, exactly. So you can also go to this link here, which is the American Public Health Association. What is public health? To find out more about public health if you're interested. And we look forward to seeing you in Public Health 101, we hope.
Yes. All right. See you there. Bye-bye.
Thank you.
Bye-bye.